Good evening, everyone. It is Friday. Friday evening, you know where you are. You're in doctor's orders. We've been doing this for about 8, 9 years now, and it's just a good time learning about health topics. We are all a part of a healthy living community known as the Juice Plus community. My friend, my buddy, as y'all all know, who's been here a couple times, I call her my personal Dr. Google. Dr. Coach Carla is in the house tonight, and we're going to be learning some things. But just briefly, I'll share a little bit about our company that we are so super happy and blessed to be a part of. The Juice Plus Company has been around since 1950. We are the company that introduced smoke detectors in 1970. And then we went into air filtration and water filtration. And then in 1993, with the help of Dr. Smokey Santillo, Juice Plus came onto the market. And we have been in this vein since 1993, just providing good nutrition for to have people have healthy living around the world. I'm so glad you're here. And I'm going to turn it over to my good friend, my personal Dr. Google, Coach Carla.
Thank you so much. I'm so excited that we're all here today. Thank you, Ruth Presley. You are my favorite. Uh, you are the hostess with the mostest, and we're just really excited to have everybody else here. And what are we going to talk about? The gut, from the lips to the anus. Ooh. Well, some of you already know my story. And you may not be aware that I come from a family of people who had sensitive stomachs. I was surprised to realize that I was not the only one who was suffering. My parents, my cousins, my aunts and uncles, it seemed as though everyone in our family had sensitive stomachs. So it became so normal for us. One person or another was experiencing gut distress or acid reflux or having to stay in bed all day because something was going on with their stomach. So it was a great improvement to find when my goddaughter introduced me to the documentary Forks Over Knives and to Dr. Michael Greger's presentation, Uprooting the Causes of Disease. It was great relief to find that, number one, most of the pain that I suffered was self inflicted, but I could do something about it. I could change what I ate. And so the, I was excited to have the prospect of no longer having horrible bouts of gas pains or that were really debilitating. And so I went on to experience improving health as I added more fruits and vegetables. And as you know, I was introduced to the concentrated fruits and vegetables in the Juice Plus product. And I went from constantly having gut issues, constantly having to have a little bottle of vinegar in my purse to try to help with my digestion, um, having my goddaughter buy me digestive enzymes when they were on sale so that I could always have them. I went from that to very seldom ever having gut issues. They would occur once in a while and usually associated with something I'd eaten. But the difference was night and day. And so, why am I telling you this story? Because you may know someone who is still dealing with gut issues, whether it's heartburn, bloating, constipation, some form of GI distress. I want you to know that's not normal. And they don't have to live that way. There is hope for them. And you can tell them about what we are sharing here today. So, as we all know, the information that I'll be sharing is not meant to replace a consultation with your medical professional. They know your history and I don't. And they may have access to information that could be beneficial so that you can make an informed decision about what you're going to do with your health. And please don't make any changes to your medication protocol or any preparations for a procedure that you've arranged with your physician without discussing the information that you're hearing today. Well, we all know that the gut is divided into several regions. From the mouth, which with our teeth we use to crush the food that we eat so it gets into very small particles. I don't know about you, but I was told to crush and chew my food until it turned liquid. How many of us even do that? But once you swallow, there's a tube that goes from the mouth through your chest into past your diaphragm into your abdomen, and that's known as the esophagus. That leads into the stomach, and the stomach is if you put your hands together like that, that will give you an idea about the size of your stomach. And the stomach is a muscular organ. It has 3 layers of muscles that go in different directions so that it can churn up and mix up the food. And that's where a lot of digestion, and because many of us have had acid reflux, we know that there's acid in that stomach. Anyway, after the stomach, you go into the small intestine. It's divided into different regions, the duodenum, and then the ileum. And the small intestines is long and convoluted and folded. And then it leads at the junction just past the appendix into the large intestine or the colon. And the colon is also divided into regions. There's the ascending colon on your right side. There's the transverse colon that goes across your body. And then there's the descending colon that goes down your left side and towards your back and leading into the rectum and then the anus, where the waste from your digestive system is released into the toilet. So each of these areas of the stomach has a distinctive lining and distinctive function. So much so that if you took a cross section from any section, any good anatomy student can tell you which part of the digestive system it came from, because each part is so distinctive and they all have different functions and they have different types of cells. And if you look at your fingers and your toes, any part of you, your skin, even your hair, it all comes from what is allowed to get into your body through your gut. We are built from what we eat and what the gut allows to get across the gut-blood barrier. Well, according to Dr. Tamara Sachs, the #1 class of drugs that's sold in this country, and I guess there's a competition between this class and the statins, is drugs that that impact the gut. So whether it's for heartburn or bloating or constipation or other forms of GI distress, those are the #1 selling drugs. Well, that means that there's so many of us that are experiencing distress. Now, we used to think of the gut as a tube, a complex tube, but a tube nevertheless. And the only thing that's in there is the food that we put in. In the past 15 to 20 years, we've become aware that there's bacteria, there's something called the gut microbiome that fills that whole tube, and that's not, so it's not just the food that we eat, there's also bacteria in there. And it's made up of bacteria and viruses and old bacteria called archaea and fungi. And some researchers say 2/3 of the DNA that we carry around comes from the bacteria. It's not even our cells. There's so many bacteria there that they provide 2/3 of the DNA. Well, most of them are harmless or helpful, but there are a few harmful ones. Now, when we think about the bacteria in the gut, We call them probiotics. You can think of them as a factory. They are making stuff. They're not just living life, they're actually making stuff. Um, and they're actually in great demand. I've had many people come up to me and say, should I take probiotics? Because now that we know that they're there, should I add more? Well, I usually say if you've been exposed, and Dr. Tamara Sachs mentioned this, if you've been exposed to antibiotics, if you've had digestive upset, if you've been taking oral drugs, many of which impact the bacteria, if you've experienced stress, high levels of stress and anxiety, if you've been exposed to drugs like birth control, then you may benefit from supporting your gut microbiome because you may have less. And my mentor, Dr. Pam Popper, is quite clear that babies born by C-section have a lower diversity of bacteria because they did not pick up bacteria as they were passing through the birth canal. So they pick up hospital bacteria. And Dr. Sachs mentioned that many of the babies that are born now have very few species of bacteria in their gut. So, from throughout our lifestyle, and according to Dr. Suk Cho, who developed the product that I'm going to be mentioning later on today, our diversity increases through our middle years and then begins to decline. So whether it's because of your age, whether it's because of your exposure to antibiotics or other drugs, whether it's because you've been ill, whether it's because you've had diarrhea or constipation, you may benefit from gut bacteria, probiotics. But as with any factory, if you don't put something into the factory, if you don't have fuel to put into the factory, then it's a waste of time. So you don't only need probiotics, you need the food for the bacteria, which we call prebiotics. So, what are prebiotics? These are complex carbohydrates, aka otherwise known as fiber, and they're only found from plants. So you take the bugs, you feed them with the plants, and together they do several beneficial things. Now, I have to remind you that this has been going on for a long time. People have been asking for probiotics and purchasing them. But according to the research, most of the people who are taking probiotics do not have any clinical evidence of their being effective, any sort of healthful change, in other words. So, what do these probiotics with the prebiotics, what do they do? Number one, the bacteria produce mucus that forms a cushion, a barrier on the gut wall. So they protect the cells of the gut and they reduce the amount of substances that can go through and cross the gut blood barrier, making sure that only good things go into the bloodstream. Then they also produce new compounds. So fiber, we can think of fiber like a mesh, and our digestive enzymes can only cut off the edges of the mesh. But bacteria can break down the fiber. And when they do, they produce substances known as postbiotics. These substances include things like vitamin K2, vitamin B12, short chain fatty acids. You may have heard of butyrate and propionate and valerate. We don't have to get caught up in that list. The thing is, we just need to know that the gut bacteria, they're not just hanging out and having parties in our digestive system, they are working for us. They break down the fiber, not all of it, but a lot of it, and they produce compounds that our body needs. And what do these compounds do? They impact our inflammation, they reduce inflammation, they contribute to immune cell function. As I mentioned, they protect the gut. They impact our joints by reducing inflammation and providing lubrication. They affect our appetite, our mood, our brain function. Now, how many of you have ever had a gut feeling? They also impact hormones. We've been hearing a lot about certain hormones, GLP-1 and PIY, that are associated with um, glucose control and metabolism and weight management. So all of these aspects are impacted by what is going on in the gut. And you have the gut brain axes, different ways that the gut communicates with the brain. You have the gut and it communicates with different parts of the circulatory system, the heart, the blood vessels themselves, the different organs, the liver, the kidneys, uh, the bones, all impacted by what is going on in the gut. So you may ask the question, where can we get these probiotics? And I'm glad you asked. I'm going to try to share my screen. Let's see. Okay, here we go. I'm going to try to share my screen and answer the question of where can we get I don't know if you're seeing it yet. Are you seeing it?
No, ma'am. Now we are. Yes.
Yes. Where can you get it? I'm glad you asked. The Juice Plus company has developed Dr. Show and um, his his co-workers have developed what we call the super biome. Now, what's particular about the super biome is that it's made up of probiotics, both lactobacillus species and bifidobacillus species, and they come in a little bottle. And instead of just having one species, actually 9 different species of lactobacillus and bifidobacillus. So you're getting variety. And that is one of the characteristics that is necessary. Diversity is very important in the gut microbiome. It contains 20 billion colony forming units. That's a way of describing how many bacteria. And you want them to form colonies. Now, you may know of some products where the numbers of colony forming bacteria are much higher, maybe 10 times higher. And that's because they want to throw in so many bacteria that the bacteria are very sensitive. And so as they pass through the stomach, many of them are killed. And so they want to put in large enough numbers that some will survive, make it into the small intestines, and hopefully make it into the large intestines. But instead of doing that, the Juice Plus company has produced a smaller amount of bacteria and placed them in a delayed release capsule. Now, this delayed release capsule will allow the bacteria to survive through the stomach and get into the parts of the digestive system where they need to be. So, and they're also vegan friendly. But
Excuse me.
in addition, so you have the right amount of bacteria, you have diversity, you have them protected so that they can make it through the GI tract, but then you also have the prebiotic fibers. The prebiotic fibers come in a little sachet that you can put into water. There are about 6 of them, 5 or 6 of them. And these fibers, they are gentle on the stomach. They support colonization. They feed the bacteria, but they also feed them at different phases throughout the gut. So you don't have this tendency, like if you have one fiber, there's a tendency for bloating and discomfort. But because there are several different fibers and they feed the bacteria at different phases in the gut, there's less bloating and less fermentation. Those fibers come from Jerusalem artichoke, hickory root, acacia, and it's about 14% of the fiber requirement. Different experts say that women need about 35 grams of fiber and men need about 40. So this is about 14% of the fiber that you need. It's non-GMO, it's gluten-free, it has a nice citrusy flavor with no added sugar. And because it's different fibers, it promotes diversity of the microbiome. And as I mentioned, it supports the colonization of these bacteria. So when you purchase these 20 billion colony forming units, you don't have to worry. They're going to stay in your body. They're going to form colonies. They're going to be able to be fed and be comfortable. And of course, together, the prebiotics and the probiotics will produce the postbiotics of the short chain fatty acids that work with the phenolic compounds and the plant nutrients from the other Juice Plus products. So what can you expect? I mentioned that most people who are taking probiotics can't really speak to clinical effects that they're having. The Juice Plus company is all about the research. So they are conducting double-blind, placebo-controlled research that they'll be looking at body composition, the impact on sleep, metabolism, and inflammatory markers, how many and which ones of the short chain fatty acids show up. They'll be looking at fecal samples and the diversity of the bacteria. But so far, according to Dr. Tamara Sachs, we already know that you can expect improved weight management, improved blood glucose control, and a hormonal impact on that GLP-1 and the PIY, so that there'll be improved appetite control, cognition, and mood. And in fact, Dr. Sachs said that very often when you're craving fat and sugar, it's the bugs in you that are craving it. So with this, by feeding the bugs the prebiotic and by having the right diversity of probiotic, you can reduce the cravings, reduce inflammation. The Juice Plus company is all about bridging the gap. So whether you're eating the standard American diet or whether you're on that continuum and you're actually eating the a whole food plant-based diet, which is what the medical professionals recommend, you know that you can count on the Juice Plus products to help you. You've probably already heard of the Juice Plus Quad. 30 of 10 fruit, 10 vegetables, 10 berries, all available for you in capsule form. And the omegas. Well, we now know that all of these feed the gut microbiome. And they produce polyphenols, and the bacteria in your gut actually produce compounds that aren't in the concentrated fruits and vegetables of the Juice Plus. So you are already moving in the right direction. And then, of course, we have the complete shake. Now, the complete shake is unique because not only does it have um, protein, it also has fiber. So your complete shake is feeding your gut microbiome along with the fruits and vegetables that are contained in the complete shake. And the Perform shake has an even higher level of protein and fiber for those who are um, recovering from sports. We then have the Luminate. Again, bridging the gap. For those of you who are dealing with sensitive reactions to coffee, you want to cut back on your coffee, have the effect of the caffeine has been noticeable for you, and you want to make a change, the Luminate bridges that gap. It provides focus, alert, while being calming. So this is standing in the gap for those who are ready to make that transition away from the traditional coffee. And then, of course, we have the superfood, which is the fruits, the 30 fruits, vegetables, and berries without the capsule. And for those of you who have family, you can participate through the Healthy Starts for Families. You get started on concentrated fruits, vegetables, and berries, and then as an adult, and then a child can be sponsored and get access to the fruit and vegetables from 4 years old through 24 years old. But now we go ahead and we're bridging the gap for the gut microbiome. Because with this, you can now supply your body with a diversity of bacteria, and you can feed the bacteria gently at different parts of your gut so that you have a great environment for your bacteria to grow and help you. I want to share one more thing is that this comparison of different products that are on the market. So as you'll see, the Juice Plus product checks all the boxes. I'm going to make this a little smaller so that maybe you can see it more clearly. The Juice Plus product checks all the boxes. It contains the 20 billion colony forming units. It contains 9 or more bacterial species. It's a good source of probiotic fiber. It contains 3 or more diverse sources of probiotic fiber. It's vegan and gluten-free. It's made with non-GMO ingredients, which is common to most of the samples with which they compared it. But it's the only one that's certified kosher. So this just one of the questions someone asked me was, I see things advertised every day. Why is the Juice Plus Super Biome superior? I hope that the information that I've shared with you just gave you a glimpse of why it's superior. It is 9 different species. It is in a delayed release capsule, so that means it can survive. It comes with the fiber to help colonize the bacteria. It's gentle, so it goes through your system without the bloating and the discomfort of many other single fiber units. And we already know that it's going to do our body good. We've seen the research, and there's more research to come. Double-blind, placebo-controlled, the highest quality of research, which the Juice Plus company is known for. So if you've got questions, please stay on after the recording. And I hope you enjoyed the time we spent together, and that you'll be back with us. But there's something that we say every time we get together. So my friends will unmute and they'll tell you to
Eat
Eat
more
more fruits and
and
vegetables.
vegetables. That's right. Eat more fruits and vegetables. This is Coach Carla Joyce saying, eat more fruits and vegetables, get your super biome, and we'll see you again next time. Thanks for joining us.